This is a demonstration of offsetting a ostomy pouch to accommodate a incision or other dressing, likely a midline abdominal dressing. So what we're going to do is initially just clean our skin and do our wound care. For the purpose of this video, we have already completed wound care to this incision and it is now open to air. So with tap water and gauze, we are going to clean the skin and stoma. The stoma tissue is mucosal, so it's just like that of the inside of your cheek. So you can be a little bit aggressive with it, especially if it's newly post-operative. You may notice a small bit of scant bleeding, and that is okay. We're gonna go ahead and just wipe it all off. And being mindful that this is a tender abdomen. Okay, now that we have our clean skin ready to go, what we're going to do is measure our stoma. Post-operatively, the stomas are usually quite edematous and eventually mature, but for now we expect them to be a little bit changing in their measurements as the days go by in post-op. So we're going to see, it looks like about 1 1/8 is what I'm measuring here. I can see just a hairline of belly skin where the measurement guide lands, and so we have included the entire stoma within our measurement. So on a Ward stock Hollister ostomy pouch here for stool, this is drainable with clamp closure. What we can do is offset where this sits so that we don't have to put the pouch on that incision. So we're gonna kind of move it over. And with that, we're gonna kind of treat this as a mirror image of itself. So what I want you to do is look at your pouch and notice that this round hydrocolloid brown material is where you can cut your hole to accommodate the stoma. So anywhere within this outer black line is acceptable. Instead of centering it, we're gonna just move it to one side so that when this is on, the tape is not sitting on our incision and the sticky part of our pouch is adjacent to our incision. So 1 1/8, I'm gonna take a marker for the sake of seeing this clearly. We're gonna just move this pilot hole as a guide is centered to the side. So you'll see here that this darkened area is where I'm cutting out. So by the time we put that on, it's going to be moved over. And that will help our patient remain more comfortable. I'm gonna open our bag like a bag of chips so that there's a nice air pocket in there so I don't cut the plastic and cause a leak of stool or air. And I'm gonna go in through the pilot hole with my round iris scissor. You can find those in a debridement kit in the supply room, and cut out that nice measurement we did of that stoma. Now, the fact that this little spot is open is okay. We can always put a little skin prep on the skin if we're worried about moisture there, but really this is a nice tall stoma, so stool, bowel sweat, and liquids should go down and into the pouch quite nicely. So you can see before we take off this plastic backing, we're not gonna take that off until we are darn sure that this fits nicely for us. So you can see we got the whole stoma in the pouch, and we've offset our pouch so that this incision is now open to air. It's all right if we would like to trim these tape borders, especially where this white paper strip sits, because that's really just kind of a nice collar of tape to hold that adhesive on. But it's not 100% necessary, so that is why we're offsetting this. So we remove the backing. We're gonna dog ear these little white tape borders so they're easy to grab later. And go ahead and put on your pouch. Around that stoma, nice warm flat hand over the bag and pouch and adhesive for about 30 seconds. And then you can take off these tape borders by just pulling them gently down so your tape collar can smooth down. Now, before I take off this one, I want to show you that you can either take it off or you can trim it off a little bit. The important part is that the hydrocolloid backing is adhered down. So that would be, you know, here. It's hard to tell with the coloring, but that's stuck on there because it's that sticky material. The tape borders are removed, and there you have applied your pouch next to a incision. And then with our clamp, we'll go ahead with that and close our pouch down nice and low. One fold up and over is just fine for